Hi, today I wanted to talk about metabolic health. Now, I've been listening to a podcast by Andrew Huberman. I seem to like his podcast at the moment, very informative. Anyway, he's done a podcast with a chap called Dr. Chris Palmer. The podcast is entitled Transform Your Mental Health with Diet and Lifestyle. Very interesting, I thought, especially considering I facilitate and support mental health talks and have my own mental health, as we all do. So yeah, it's all about how improving your metabolic health can improve your mental health, general well-being, and the theory is it's because it helps with mitochondrial function, which I find hard to say, but apparently it's very important for your cells, and it's the way your cells get information and energy to regenerate and improve themselves. I would listen to the podcast for a bit more information because they probably know more than me because they're doctors and I'm not. But I thought to myself, it's very interesting. So I did my own research and did a search on the internet. Now there's a doctor called Dr. Campbell Murdoch who has set up a website called healthshelf.org. Now he set this up to help his patients in his NHS practice. He believes that improving metabolic health can help their general health and well-being and mental health. And he's been doing some trials with a couple of his patients where they've had significant changes to how they feel around IBS, sore joints, sore back, that kind of thing. If you go to his website, he's got a wonderful talk. It's about an hour long. He covers his thinking and what he recommends people do. If you look on the website, there's also a 28-day plan if you want to try this out and see if you can improve your metabolic health and therefore your well-being. Now, as Dr. Murdoch says, this is for information purposes only, and you should get medical advice before you follow this stuff. But I certainly think it's worth people who are interested in their health and maybe struggling with certain symptoms and mental health problems investigating metabolic health. That's all for me. Subscribe, comment below if you try any of this stuff. Apologise for moving, but I'm looking at my iPad to get the details correct. Cheers all. Bye.